Have you ever wondered why NHS dentists are leaving the system and moving to private practice? In this video, I'll reveal how the NHS dental banding system works and why it's pushing dentists away. I'll also talk about how the shift to private dentistry is transforming the way that patients experience dentistry in the UK. I think you'll be quite surprised at how the NHS dental system affects both patients and dentists. Hi guys, if you're new here, my name is Komal and I'm a dentist based in the UK. Let's dive straight into the world of bands and UDAs in NHS dentistry, specifically Band 1. So first of all, let's clarify what NHS bands are and what the dental banding system is. There are 4 bands in the NHS, and Band 1 is the examination band. It includes a full checkup, it includes medical history, social history, x-rays, advice on oral health and diet. What people don't usually realise is that this Band 1 is the most important step in a patient's oral health journey. An examination or a Band 1 covers more than just a quick checkup. It actually takes a lot of time and skill and effort and care to understand each individual patient and their needs. A Band 1 is reimbursed by 1 UDA. This is worth about £8 to £15 depending where you are in the country. Let's make this easy to understand and say that our dentist is getting £10 per UDA. Like I said, under a Band 1, a dentist is expected to conduct a full examination, take relevant medical and social histories, review x-rays or take new x-rays, provide diet and oral hygiene advice and smoking cessation and alcohol cessation advice. All of that needs to be done in about 10 to 20 minutes. If a dentist spends only 10 minutes on a checkup, it doesn't leave much room for personalisation, but they will gain 6 UDAs an hour, which in this case equates to £60 an hour. If a dentist spends 30 minutes on a checkup, they will have much more time to carry out the checkup properly, get to know the patient and understand their needs, but they will only gain 2 UDAs an hour, which in this case equates to £20 an hour. The length of a checkup usually depends on things like UDA targets in the practice, the policies of the practice, the experience of the dentist, and the personal preference of the dentist. But can you see how this is a catch-22? In an average practice, dentists are expected to perform typically around 4 UDAs an hour, so 15-minute appointments for the checkup. If they fall behind on their target, they're not only losing money for themselves, but for the practice as well. This usually leads to situations where dentists are expected to work at full speed, and working at full speed just to meet these targets can sometimes compromise patient care. Because don't forget, if the dentists don't meet these targets or quotas, the NHS will actually claw back money from the practice. Let's take a moment to think about the strain this puts on the practice and the individual dentist. You can imagine that working under these conditions for long periods of time doesn't leave much room for rapport building or personal connection, or even making thorough treatment plans. The system is all about efficiency and not really about skill. Let's be honest, when a patient is seen in 15 minutes, it is hard to get everything done to a high standard, especially when it comes to giving the patient all the options and explanations they deserve when it comes to their oral health. With the financial and time pressure of the NHS system, many dentists are moving to private practice. But why is that? It's because in private practice, dentists are no longer limited by the UDA system. Firstly, there's a lot more time per patient. Private patients don't have to feel rushed. Dentists can utilize their time and digital tools to better explain diagnoses, procedures, and give a variety of treatment options. Also in private practice, there is no need to constantly explain what you can and can't offer due to the NHS limitations. And when it comes to hygiene, private practices can offer specialised comprehensive treatments like airflow therapy with an in-house hygienist, or periodontal therapy without the pressure of UDAs. In private practice, the financial model is completely different because dentists aren't paid on units, they're paid on each service that they provide. Think of the NHS banding system as a subsidised prescription charge. The patient only pays the low price of £26.80 for their exam because it is subsidised by the NHS, not because that's how much the examination is actually worth. Just like a patient may pay £9 for their prescription when those medicines are actually worth thousands but being subsidised by the NHS. I hope that makes sense, and when I heard this analogy, it really clicked for me. Yes, the crown on the NHS is that price, not because that's how much it's worth, but it's because you're getting a very discounted treatment because you're part of a kind of NHS membership. And if you're not part of that membership, you pay the full price for the crown. So why is it that most dentists have been moving to private dentistry over the past few years. Well, with the constraints of the NHS system, many dentists are finding private care more appealing. Not only can they offer better care, but they can also earn a fair income for their time and skills without having to worry about the quotas is one of the biggest driving factors. As you can imagine, if you're getting paid fairly, you're getting to spend more time with your patients, you're getting to build a proper connection with them, there's going to be a greater sense of fulfillment and the dentist will be happier. And what does this mean for patients? Well, if you're a patient on the NHS, you'll likely get more streamlined and efficient and quick treatment, but you won't always have the luxury of time, cosmetics, and a wide range of options. A patient in private care may pay more for their examination, but in return they'll get more time, more attention, more personalization, and more advanced technology. The choice ultimately comes down to what the patient values and what the patient wants. Is it convenience and cost, or is it more of a tailored dental experience? And neither is wrong. I can understand it's a very tough choice for both patients and dentists, but understanding the differences can help patients make the choice that's right for them. I hope this video gave you more insight into how the dental system works and why so many dentists are leaving the NHS and going into private practice. Let me know your thoughts and comments below, and I'll see you in the next video where I will be diving deeper into NHS Bands, Band 2, 3 and 4, and how it differs from private dentistry.